from the whole experience, from walking in the door to leaving the door, you'll find that it's really friendly, that the physios explain everything to you, so you know exactly what treatment you get, and you've got a kind of an idea of how long it may take to get better and what your other options are as well. So the longer you leave it, the longer you're just in mid-air really, and you're not going to get anywhere to get better.
After the physio, it was the first time, it must have been in 15 years, I didn't have to wear a strap on my leg.
Mm-hmm. And that helped because you like your tennis?
I like my tennis, yeah. I was able to play tennis and go in the gym, which I stopped doing. I'd even stopped swimming.
Well, it wasn't only just the physio side of it, it was the exercises.
Yeah, exercises
that you had to do after, which, to be perfectly honest, was not always done as what's supposed to be done, but did do them. So it's not just the physio part of it, it's the after as well, what you've got to do to keep yourself as right as you can.
Siobhan, I'm 37 from Hartlepool, I'm a hairdresser. I have a back problem, which is, I've had an MRI and it's been diagnosed as a disc bulge with facet joint degeneration, I think it's called. So I've tried various other treatments about 3 years after the back pain commenced, because you kind of expect that it's just going to subside, but it doesn't. But I found physio to be the best kind of treatment. The downside is that obviously you're given exercises and you wonder whether you're doing them correctly when you go home, but if you come for regular treatments with Paul, then he kind of tests you to make sure that you've got them right.
Think back to pre-coming for physio or for any treatment. How long did you wait before you first came? So your back pain started?
The back pain started, various GP visits, which doesn't really get you very far, and then I probably started having treatment probably about 3 years after the back pain.
3 years? Wow.
Yeah, I lived it a long time.
So what was the reason? Why did you wait 3 years?
Because you don't know what it is, and you presume that it's down to your profession, and you expect that eventually it's just going to go away by itself, but it just progressively gets worse.
What were you told? What did GP say to you?
Not very much really. They just kind of gave me some pain relief, and they didn't seem to want to find out what was actually wrong. It was only when I had severe flare-ups that I had an MRI done that diagnosed the problem.
And what about before coming to see physio? What was the one thing, if you could have asked a question, what would you want to know about physio and the experience? Or
whether it just kind of eases the symptoms or whether it can correct it altogether. I wasn't really sure what the end result after physio would be.
What's the best thing about physio?
The massage is quite nice.
Not the pain that I caused you?
No, the pain's fine. And obviously it for me personally reduces a lot of stiffness. I feel like I have a lot more mobility after I've had the physio treatment.
What about coming here? What do you enjoy about coming here the best?
It's relaxed, I guess, relaxed atmosphere, and recommendation, I suppose.
If you had a friend who had a bad back or a shoulder or neck, would you recommend physio?
Of course.
How would you describe it?
Yeah, of course, yeah.
How would you describe physio? To your best friend. Imagine your best friend's got a bad back. How would you describe it to her?
How would I describe physio? I suppose manipulation to free up the joints, with that little, I don't know what that is that you do.
Crack.
I don't like the crack thing, yeah. I'm not too keen on the crack, so I'd just tell them to hold the breath when you do the crack.
Shut their eyes and put some earplugs in, basically.
And don't yelp like I do.
The reception is there's a barrier, and you can't speak with them, you can't...
Once you've checked in, you've got to set your feet out the way.
That's you gone, whereas here you don't get that.
What you get here?
Maybe
coffee, TV,
our life stories.
Agony ends.
Yeah.